Gentlemen, well, we know our knees wear out over time, but so do our hips. And if it gets bad enough, you may need a hip replacement. Well, Centennial Hills Hospital is offering an innovative technique that's changing the way the procedure is done. Lindsay Simon has more.
Meet the robot that's helping surgeons and patients in the operating room. It's called the MAKOplasty robot, and it allows for more precise joint replacement. Using a computer program prior to surgery, Dr. Mark Rosen is able to map out the area he needs to fix.
Bottom line of the advantage is that we know that long-term what determines how well these hips do and whether or not they need to be redone is how well positioned they are.
Once in the operating room, he plots tracking points on the patient's joint, and in this case, the hip.
We take this probe here, and we would then touch a point, that blue point, where we think it's in the pelvis. And actually, there's, I think, about 30 of them or so. And the computer sees where this is in space. It can make a three-dimensional surface, and basically, you're done. You know where it is in space.
And that's when the MAKOplasty really comes to life. The surgeon is the one operating it, but if by some chance he starts to drill outside of that map that was created, the robot will automatically turn off, minimizing any chance of mistake.
The problem with the way we've done it prior to MAKOplasty is it basically depends a lot on our eyeballs, the surgeon's eyeball. And that being said, the reason the MAKOplasty is such an advantage is if the metal and plastic isn't put in exactly correct or within what we call the safe zone or a zone where the bearing is perfect, then you can get early wear the prosthesis and it won't last as long.
With the MAKOplasty procedure, the prosthesis should last 20 or more years, meaning you're out of pain and most likely will not have to undergo the intense procedure again.
It's not like changing your tires. If a prosthesis fails, it's less predictable with regards to the result every time it's redone.
Local high school teacher Michelle Healy is one success story example.
It's an incredibly eye-opening process to discover that you can't go where you want to go. I was generally very energetic. My mother said I was born running. So when I got to the point where I couldn't walk without a cane, where I was so slow that I was always behind people, that's when my husband realized that there was something really wrong here and that it needed to be fixed.
Michelle underwent bilateral hip surgery recently, and before making the final decision to have the procedures, she did her research.
When I looked into MAKOplasty, one of the things I was curious about was their success rate, which seems to be really good. About 98% is what I remember. And I thought that that was a really good reason to do it.
And now, after her surgeries, the pain and the cane are gone.
I do not have a cane, I'm not on a walker, and to be able to go any place I want to is going to be thrilling, just thrilling. The only thing I regret was that he wasn't able to make me taller.
Well, for more information on the MAKOplasty procedure, you can visit centennialhillshospital.com or give them a call at that number right there, 702-388-4888. Well, up next.